Good afternoon. I'd like to call the Ways and Means meeting of November 27, 2012 to order. Please do a roll call.
Commissioner Cross?
Here.
Commissioner Derazinski?
Here.
Commissioner Engel?
It's here somewhere.
Commissioner Drager?
Here.
Commissioner Longmire?
He's excused.
Commissioner Mahoney? Commissioner Plummer?
Here.
Commissioner Skolnick?
Here.
Commissioner Snyder?
Here.
Commissioner Wilkins? Here. Commissioner Collins?
Here. Thank you. Approval of minutes of November 1st, 2012.
Second.
Seconded. Any corrections? Corrections, all in favor say yes.
Yes.
All opposed say no. Motion carries. Public comment on an agenda item. Anybody would like to speak today, please address the, state your name for the record, please.
Susie Hughes. I'm sure all of you get questions all the time. This is my first time to get questions from the people, but I did say that I would bring them to you and ask. First, I got a lot of questions from people. I don't know if that's normal or not, but I started at the top. Is there a time that the residents can come and comment to the board and get answers? That was one of the questions I got. A lot of them were about things on the agenda today. First, the generic service credit. Now, these are exactly what I got. What will the county pay for any? Will the county pay for any contributions and matches along with the payment for generic service credits by an employee? What is the cost to the county for the increase this will have in retirement paid out because of this? What additional health care costs to the county will be associated with this? What other costs besides accrual costs are associated with the purchase, and who will have to pay those? Will this be paid in a lump sum by the employee, and will that payment go directly to MERS? And is this option available to all county employees? And several of these questions came from county employees because I got the question, is this option available to all employees, several times. Also, on the establishment of 56 new positions, one question was, does that create a whole new department? And if this is a new program, is there a local agency of business that provides the same services that we could hire, promoting local businesses and local workers and save our ever-increasing labor and benefit costs to the county? Will any of these positions eliminate current positions so they won't actually seem like 56 positions? And where in the budget is this expense planned for? That's all I got, but I don't know how many you guys get, but I was astounded at how many I got, so thank you.
Is there anybody else? Thank you. We'll move on to items for consideration with addendum number 154.
So moved.
Second. All in favor say yes.
Yes.
Opposed say no. Carries. First item is WM 12/11-145 of administration. Let's approve the accounts payable.
So moved. Second.
Moved and seconded. Questions? Comments? Seeing none, all in favor say yes.
Yes.
All opposed say no. That motion carries. WM 12/11-146 of Human Resources.
So moved.
Second.
Moved and seconded. Comments? All in favor say yes.
Yes.
All opposed say no.
No.
One no. Motion carries. WM 12/11-147 from Human Resources. Approve the continued membership for Muskegon County with the Michigan Municipal Risk.
Second.
Moved and seconded. Comments? Seeing none, all in favor say yes.
Yes.
All opposed say no. That motion carries. WM 12/11-148, Human Resources. Authorize Tony Tag to purchase 4 years and 3 months of generic service credit.
So moved. Second.
Moved and seconded. Discussion? Mr. Jager.
I think the question of, are all employees of the county eligible to buy them?
Yes, they are. This is a county policy for all county employees.
Mr. Skolnick.
No, I just like to reaffirm the fact, I think I know, but I just would like to hear it said again. Just because, when I read this, I mean, it's a lot of money. Is there any cost to the county whatsoever?
Debbie Carnaval, Human Resources Director. No, the actuarial is done by the retirement system, and they calculate out with interest being earned on current deposits on file, plus this amount, what it will cost to have a lifetime benefit.
Okay, so when an individual who qualifies requests this, a letter is sent to MERS, a request for an amount.
Yes,
And
yes,
they
we request the actuarial.
And so what about the health insurance piece of this?
It doesn't change. The employee is eligible for the same health insurance,
Whether or not
whether or not they have
whether
time.
or not he had purchased the additional years of service.
Right, because he was eligible for full retirement without buying this time, so his health costs would not have changed.
So we've done this, I know in the years I've been here, we've done this a number of times. This is not unusual.
Correct.
And there's absolutely no cost to the county going forward.
That's correct.
Okay.
Mr. Garazinski.
Debbie, I wish you had that chart that you showed us how they calculate that. This is quite a large amount, and it just happens to be because of this particular employee. I don't have a problem with it, but I would like us to take a look and really study this policy. I'd like to go over that chart again, where you kind of showed how it's calculated out. At some time, could we review this policy? I think other people have that same question. Second thing I want to say, heaven forbid if Mr. Tagg doesn't live that long, we actually gain on this, don't we?
Catching your bat, Jim.
But there is that possibility. There is, I mean, if you would be 106, but yeah, the converse is true on these. I mean, just to make a point.
Mr. Snyder.
Well, I'm going to vote in favor of this because it's a policy that we've established, but I want to make the same point that you cannot absolutely say that this is totally without cost. And this policy really needs to be reviewed. There is the potential for cost involved in this, and don't mistake that. So, just as there is the possibility for forfeiture, actuarial science is less than exact. So this policy really needs to be reviewed because you could have a wholesale evacuation, if you will, and you could incur some huge costs in the future that are unfunded. And the policy needs to be reviewed.
Mr. Engel.
Isn't this a policy set by the MERS folks? Isn't this their option that they put out there?
It is a policy that's available through MERS that municipalities adopt. And the county's policy that was adopted previously by this board was you could purchase up to 5 years of generic service. So it's a policy that's been adopted, but it could be rescinded too.
Mr. Skolnick.
I had some questions on this too, and I did a little research, but I mean some agencies allow you to buy this. Our policy is you can buy it within 90 days of retirement. Is that correct, or within some short period of some window?
Yes, 90 days.
It's 90 days. I've heard that some organizations, municipalities, governmental entities, allow you to buy that years in advance.
That's correct. Some can allow it you can buy it any time during your career, which would not be a true cost then because you would be purchasing it at a lower salary and retiring at a higher salary.
Correct.
Ours is a true cost because we only allow them to buy it as they leave service.
But that the the ability to buy it earlier in one's career is not unusual.
No.
We don't do that, but I mean,
Right.
that is happens.
Some
yeah.
allow that.
Commissioner Jager?
Yeah, it says the plan's investment and return is projected to be 7%. Now, if it doesn't do that for 2 years, our amount of money that we have to pay through the plan goes up. So wouldn't that be a cost to us?
And the interest could be higher.
Well,
I
but
mean, it's just, it's an estimate.
But we have some
Actuarial
plans
estimate.
that are at 31% right now. So, I mean, this could add that to 32% or 33%. If the stock market don't make 7%. And we haven't been averaging that for the last 5 or 6 years. Thank you.
Any other comment? Seeing none, all in favor of the motion, say yes.
Yes.
All opposed, say no.
No.
1 no. Motion passes. WM 12-11-149 from Human Resource. Establish 56 new positions, 2 reclassifications, and 3 title changes in the Department of Employment and Training.
So moved.
Second.
Moved and second. Mr. Jager.
Yeah, no, this is to get rid of the Orchard View schools thing, because it used to be the job training through Orchard View.
We currently contract with Orchard View Schools, Goodwill, and Whitehall Schools to
So-
provide these services.
Right. Now, do we have a total cost of what the savings would be, because we got rid of that over there, and I see it's 900,000, but is that the total cost for getting rid of all these buildings, but taking on all the new SPX building, and is that what the total savings would be from
This is just total staff savings.
Do we have a total cost of what this is, the savings is gonna be by going to these different buildings and all that, or?
And we have that too. I don't have that with me, but we are saving in facility costs by consolidating, plus this is the savings in staff
So we
costs.
could be looking at over $1 million getting out of Orchard View and move more into the,
Correct.
and the other one. Okay, thank you.
Mr. Skolnick?
Debbie, just because if you look at the motion, it says that we're establishing 56 new positions. So if somebody just took that out of context and looked at it, it looks like we're adding 56 employees, which we are. But we're eliminating 64 jobs that already exist with the same program.
Correct, that our contractor
That
is.
are
employing.
contractors, okay.
Any other questions?
Are these under a defined contribution or defined benefit?
They will be defined contribution.
Thank you.
Mr. Garasinski?
And I take it many of these people will be rehired into our program or some.
They will have the opportunity to apply under the county personnel system. We will open competitively recruit for all these positions.
Anyone else? Thank you, Debbie. Mark? Sure.
The funding for this is through the Michigan Works program.
Correct.
And if that funding goes away for when the contract is up, then these jobs would go away too.
Yes. It's all dependent on funding, as it is with the contractor too.
Okay. Anyone else? All in favor of the motion, say yes.
Yes.
All opposed, say no. Motion carries. WM 12/11-150 from Human Resources.
So moved.
Has been moved and seconded. Questions? Seeing none, all in favor, say yes.
Yes.
Opposed, say no. That motion carries. WM 12-11-151 from Public Health.
So moved.
Moved and seconded. Questions? Mr. Snyder.
The question I have is, I see Ken's out there. We did this 4 years ago, and it's a renewal. At the time we discussed this 4 years ago, I had asked if an RFP had been put out locally to examine whether or not someone here would be willing to bid on this contract. And the answer was, at that time, no, that there wasn't a qualified person. And I'm curious, because the indication was at that time that there would be an RFP put out locally, or would be an RFP put out, to see if this could be done locally. And I'm curious, first of all, if that was done, and secondly, where that stood, if it was done.
Ken Kraus, Director of Public Health. Last time we actually did do an RFP, Dr. DeYoung was the only qualified bidder, and that's what we selected. We think we're in essentially the same situation as we had before. So we're just making the recommendation that you reappoint her to this term of office.
I'd like to suggest that there is a possibility that that could be done locally, that there is a qualified person available locally, and that I would request that an RFP be issued to determine if whether or not that we could satisfy that locally. That's a motion.
I'll second it.
If I can just interject, we will be without a medical examiner as of the first of the year then.
I would suspect that she might be in a position to be willing to extend the contract for a short period of time on a month-by-month basis.
I'd have to defer to corporate counsel, see if that it's a term of office as I understand it.
Yeah, that's term of office, but the other question I have, don't we have a motion before?
Yes, we do.
Prior to your motion.
Oh, I'm sorry.
There is a motion on the
I
floor.
made the motion
They're in
to
discussion.
approve that.
Right. So we're in the discussion.
You're correct.
But as to the other question about the term of office, it's not a contractual appointment, it isn't for a position. It is an official appointed position. And I'm just not at all sure, I have to look into it, to know whether you can make that indefinite or contingent.
Any other discussion?
Well, I'll withdraw the motion, my motion.
Ken, could I just ask one more question? This, Dr. DeYoung has been the medical examiner for how many years?
12.
Oh, 12. Oh, I'm sorry. I didn't now I know. Sure. Okay, yeah. And I mean, it's been fine.
It's been excellent.
Okay, thank you.
Mr. Snyder?
I can't speak to her qualifications, but I can tell you that I certainly had, when we did this 4 years ago, I certainly had a number of people contact me about the fact that the cost of transportation, including funeral homes as well as individuals, was extreme. And the thought was at the time that if it was done locally, that those would be more convenient to the people who were having the examinations done here, and the cost would be substantially less.
By Mr. Pierzynski.
Just a thought I heard it discussed earlier, taking the bodies to Lansing. I don't know how many we're talking about in a year. In a month. I know it changes, and I sure am not intending to grill you on anything.
Yes, we do.
I'm Dr. Joyce Yang, I'm the medical examiner. May I?
Need to suspend the rules to...
So moved.
Second.
Moved and seconded. All in favor, say yes.
Yes.
All opposed, say no.
Okay.
Thank you.
You're okay.
Not sure who the judge is here, I'm usually in court. Pardon me, I just got my voice back today, I had laryngitis, so this is good. I think we're transporting probably about 125 to 130 bodies per year to Lansing, and I will be the first to admit that it's much more convenient for communities to have this done locally when possible. I think one of the big challenges with that is that there are only about 450 practicing forensic pathologists in the country. We have a cluster of them in Lansing, and it's challenging to get forensic pathologists into other communities, and that's why these centers are developed. Even if you get one forensic pathologist, sometimes they want to have a weekend or a week off, and so you run into coverage problems. But it is more convenient. But unfortunately, I think this is, in my opinion, is probably the best solution for Muskegon County. And if there were a better solution, I'd probably be the first to let you know about it. And we, in the state, continue to work towards more regionalized centers and having the service provided closer to that area. But I'm I know that Grand Rapids would actually be closer, but they, at this point, aren't interested in picking up additional counties and additional work, but those are actually regular conversations that we have with other forensic pathologists in the state to try and bring better solutions to these communities. And part of the proposal even is that Kalamazoo is building a forensic science center, and there'll be a group of us there. I think we're looking at, in the future, moving Muskegon to there, because you'll actually save about anywhere between $5,000 and $10,000 a year in transport costs, because it's a little closer there. So we monitor that, and I'm in regular communication with Ken and Kathy too, and if there's a better solution that fits the needs, you'll probably be the first to know.
Dr. DeYoung, how many other counties do you contract with?
We're the medical examiner's office for 9 counties and 1 nation, actually, the Gun Lake Tribe.
So you do a total of 9 counties. And, you know, I just did a little, because on the attachment to the motion shows the actual cost of transportation, and it's costing us about $500 per case back and forth total. So I don't, because there'd be some costs no matter where they
Right. Right, no matter where you are, there are transport costs, even if it were done here at Mercy.
So.
Ma'am?
Sure.
The equipment, the structures, everything is here, so it could be done. It's just a matter of having someone of your stature.
With that, with the expert, yeah, having somebody who's a board certified forensic pathologist and having that's part of it. A lot of the equipment is here. It theoretically could be done.
I think the sheriff wanted to.
Let the sheriff speak.
Sheriff, do you want to say?
Dean Rosser, County Sheriff. I just want to speak quick from the perspective of law enforcement in terms of the absolute necessity for a good, high-quality forensic pathologist when it comes to what we need them for. Because when it comes to a particular criminal investigation, basically you only get one chance to get the information from the autopsy, and so it has to be done by someone of high caliber and that has the staffing and the whole structure in place. And in my almost 25 years now in the field of law enforcement, I've worked closely with a couple, and I will speak, and this is no disrespect to any other pathologists I've worked with, but Dr. DeYoung and her staff are probably the best I've ever worked with, and the results have been very high caliber, and it's been very, very beneficial for law enforcement.
Thank you, Dean. Any other discussion? If not, all in favor of the motion say yes.
Yes.
All opposed say no.
No.
No. Motion carries. WM 12/11-152 from Public Works.
So moved.
Moved and seconded. Questions? Mr. Skolnick?
Just one question. Does anybody know why Lakeshore Office Furniture didn't bid on the bulk of the items? No? Just curious. Okay, thanks.
Any other questions? Seeing none, all in favor of the motion say yes.
Yes.
All opposed say no. That motion carries. WM 12/11-153 from the sheriff.
So moved. Second.
Moved and seconded. Questions? All in favor of the motion say yes.
Yes.
All opposed say no. That motion carries. WM 12/11-154 from Human Resources.
So moved. Second.
Moved and seconded. Questions or comments? All in favor of the motion say yes.
Yes.
All opposed say no. Motion carries. On to old business. Is there any old business? Is there any old business? Is there any new business? Is there any new business? Is there any public comment? Anybody in the audience would like to address the board today on a new topic? If you could have your name for the record, sir.
Yes, sir. Mary Hausman, Norm Shore. Tell me if this isn't appropriate or not, but when somebody like Susie asked a whole group of questions like that, and I know a lot of them were answered during the meeting, but not necessarily just now, but in general. I mean, after the questions were asked, it was complete silence, and then anybody else? No. Is there any attempt to answer these questions and get back to people on questions? I mean, or is that just a dead end? I mean, that's all, you get the questions asked and nobody thinks about it anymore.
Well, sir, this is a meeting held in the public. It's, as far as I know, it's, the public is welcome to make comments.
But I'm asking, is there any attempt to make an answer for you?
And I guess the best way I could describe it too, if the public has questions, they should contact their respected commissioner to get those answers.
Okay.
That's what we're elected for.
So the answer is no, there was no attempt to.
No, we don't have to answer questions on a topical question, correct?
Yeah. Questions can be brought to the administrator at any time to get a response. They don't come from this board. We have a procedure we follow.
Okay. Thank you.
Is there anybody else? See no public comment, I entertain a motion to adjourn.
So moved. Second.
We are adjourned. Thank you.